Hey, and thanks for joining this episode of the Weightcare podcast. I'm Sharon Polsky, your host, and I am your GLP-1 fact fairy. On today's episode, we're going to talk to Matt from Strive Pharmacy. He is a wealth of information about compounding pharmacies. And I think it's really important to talk about the safety and convenience of compounding pharmacies since they're getting such a bad rap right now in the media. And it's really unfounded. I stumbled onto compounding pharmacies, about 20 years ago when I was diagnosed with a neurotransmitter disorder. And there were some medications that could really help me, but they were rare and they were very difficult to get my hands on. And so I was working with a compounding pharmacy in order to get access to those. And I think what people don't understand about compounding pharmacies is they're very, very regulated. And so it's not like some weird little scientist in his garage putting together all of these compounds and then sending them out to you. That isn't what happens. They are very clean, they are highly regulated, and they are an amazing way to access very difficult to find medications like your GLP-1s. And in a lot of cases, they make those medications more affordable for us. And so in my case, I stumbled onto them and I was getting some bioidentical hormones from them, which was really difficult for me to get. You can't get those from a traditional pharmacy. I was also getting some other rare medications that were not readily available. I was on a wait list for them for muscle wasting and was able to get them from a compounding pharmacy. So about 20 years ago, I started using a compounding pharmacy in order to gain access to these medications. And so I was so shocked when I saw so much media coverage on how scary compounding pharmacies were. And then they were showing footage of what were not compounding pharmacies. And so it was so astonishing to me that people like myself that are getting their hormones and are getting really a lot of relief from compounding pharmacies were seeing that they were trying to put compounding pharmacies out of business, which were going to affect us in so many different ways. And it was all because of this political campaign against compounding pharmacies from big pharmaceutical companies that now wanted to produce GLP-1s and not have any competition. And so we are going to talk to Matt today. He's really, really amazing. And we're going to talk about the safety and convenience of your compounding pharmacies. I have Matt. He's the Chief Clinical Officer. That is such a mouthful to say from Strive Pharmacy. And we're going to have a conversation about the safety and effectiveness of compounding pharmacies. So Matt, thank you so much for joining me and just kind of give us a little bit of your background and how you got to here, and we'll move from there.
Yeah. Hello, everyone. My name is Matt. As she stated, I'm the Chief Clinical Officer, Strive Pharmacy. So I oversee all of our clinical innovation and product development. But where I spend most of my time is with our compliance and quality assurance, ensuring that we're offering safe and effective medications for all of our patients. And I've been a pharmacist for just about 9 years now. I've been into compounding pharmacy personally for as long as I can remember, probably since like mid-20s, 25 or something like that. And at the time, I was working in retail pharmacies and started asking myself the question, why am I still here when I love this part of medicine, right?
Yeah.
I'm stuck in traditional, but I love this personalized side of medicine. And so I made the switch over to Strive. And ever since then, just as a whole, my life has been better.
Yeah, because you get to help so many more people,
exactly.
And you don't feel handcuffed to like this corporate structure and pharmaceutical companies. You actually get to really help people.
Yeah, I get to help patients. I get to help employees now. Our employees aren't stuck to the bottom in a corporate setting anymore either. And so it just makes it so much more enjoyable. And I get to share my passion with everyone now. And I got all my family uses Strive. Extended.
Yeah. Well, it's so funny. How I met you was at an A4M conference, and you were taking clinical weight management course with me.
Yeah.
And I
Yeah.
was so impressed that somebody that was working at a pharmacy actually wanted to sit through all of this education on GLP-1s and weight management, not only to help Strive, but to help the people you knew. And that was so impressive to me.
Yeah, I love it. I'm here to learn as much as I can and then freely give that back to the rest of the population out there that's looking to better their lives.
Yeah, so I started using compound pharmacies. I have a neurotransmitter disorder, and I was trying to get some really very difficult medication to get. And so I started using compounding pharmacies many 15, 20 years ago. And they were so convenient, so safe. I never even thought twice about that. And then you started seeing all of this crazy news coverage, and they're showing pictures of not compounding pharmacies in the news coverage. And it was so crazy to me in the last year, all of this campaign against compounding pharmacies. But compounding pharmacies been around since the beginning of time, right?
Yeah. Oh, yeah. I mean, pharmacy originated with compounding pharmacies. Before there was big pharma, that's all there was mom and pop soda fountain type pharmacies where you came in and gave a script of what you needed, and the pharmacist would mix it up there for you. And so this is nothing new to the health world, right? And it's unfortunate that the media plays us out to be a bad guy or makes it seem like we're doing something we shouldn't, when in all reality, like part of our whole purpose is to fill in when there's a medication gap from the manufacturing companies. When there's drug shortages, we're here to provide what those patients need. And they're making it sound like we're doing something we shouldn't be.
Yeah, it's so absolutely crazy to me that it's gone that direction, because you do, like you said, fill in those gaps, and you're highly regulated, correct?
Oh, yeah. And so compounding pharmacies, one, we're regulated by the state board of pharmacy in which we reside, plus any of the other state board of pharmacies you may ship to. So for Strive, that's I think we're 47 states now. So that's 47 different state boards of pharmacy that we're following all their regulations, but then it goes up another level to the USP requirements. And these are the minimum standards that compounding pharmacies must follow to ensure safe, quality, effective practices. That way, patients aren't getting harmed, right? And at Strive, we go way above and beyond those minimum requirements. And then on top of that, you got FDA guidance. And those are guidelines that are set forth from the FDA to ensure, again, the same thing, safety and effectiveness of medication. And then one cool thing at Strive, we volunteered for an inspection by the National Association Boards of Pharmacy, where we basically invite them in for a random inspection, and they go and detail comb through all of our stuff. And we just blew that inspection out of the water and just crushed it. And
I
so,
love hearing that, because then you can talk about that to
yeah,
us and let people know that. Now, if I were to order a medication from you that is a manufactured medication that's on like the shortage list, I can come to you and say, can I see your documentation that proves it's the same or as effective as what's coming from a pharmaceutical company?
100%. My number one thing that I tell patients and providers when they're out there, look, they got to vet every compounding pharmacy you choose to try for the first time, and transparency should be the number one thing. They should be willing to give and share anything you ask for. And so for Strive, any powder, like any raw ingredient that we bring into the pharmacy, it comes with a certificate of analysis, but we then send it out for third-party testing just to ensure that it is exactly what it says it is before we even start to utilize it to compound medications for patients.
Yeah, I mean, I think that that's what people don't understand. They truly think it's like some creepy, weird guy in his garage mixing up your Tirzepatide or your Semaglutide, but it's not. If I order Tirzepatide from Strive, I can then contact you and say, how do I know that this is the correct efficacy? And you can provide that documentation.
Yeah, exactly. So each batch of injectable medication we make, that batch will again get sent out to a third-party analytical company, and they're going to test that for sterility, endotoxins, and potency was one thing that we do that's not required to do every batch, but we do it like 3 to 5 batches every week. And that way we can track and trend every single compounder's um, the potency of all their batches, versus like the requirement is just to do it once a year. And it's hard to track and trend data when you have it once every 12 months. And so when we can get a few every week, then we can catch anything that falls below our threshold, which is much more strict than the requirement threshold. So that means if the medication was perfect, it'd be 100% potent. Well, the guidelines say it has to be plus or minus 10%. And at Strive, we do plus or minus 3%. And so we go again above and beyond those minimum requirements. And so that batch has to pass the sterility, endotoxin, and potency if it's tested before it even begins to be used to get shipped out or given to a patient at the pharmacy.
So I'm going to ask a weird question. So if
Sure.
I was the big name pharmaceutical company that made it, how often is their medication tested to see if it's the correct potency or accuracy?
They're supposed to do it like with every lot, right? But I have anybody can go and look it up. It's the FDA has made it public. There's some counterfeit stuff that has come out from, I won't say which one exactly, but either Semaglutide or Tirzepatide, one of those manufacturers, they've had some counterfeit stuff come out of their manufacturing facilities.
And it's their manufacturing facility. This isn't like somewhere in China that manufactured it. It was actually their manufacturing facility, right?
Exactly. Yeah. That's just that's like the last step, the first step's checking the powder. And then to even begin to get in the compounding lab, the technicians have to go through so many tests and go through so much education and training, and they got to pass it all 100%. There's no pass with a C or a B. You got to pass with an A+ before you can get in that lab and start compounding stuff for our patients. And then everything gets visually inspected by a pharmacist before it even begins to go out to the third party. So like there's just so many checks and balances that we do to ensure that there's no way something is going to harm a patient. It's our number one priority.
Yeah, and I know patients of yours. Some of our clients are patients of yours. And so I know them. And they were clients that were taking Mounjaro originally, and they switched to Tirzepatide. And they'll even say, it feels exactly the same.
Yeah.
Or sometimes they say, it feels a little better. And I'm like, oh, I gotta laugh. And I'm like, I wonder if that's in their head, but I don't think it is. I think the patients that have tried both, they really know how it's supposed to feel.
Yeah, they do. I think like anyone that's on any medication that makes them feel better, as soon as they get off of it or they're taking one that's sub potent, I'll say, I guess is the kind of the best word. Like, as soon as you start feeling bad again, because for a lot of patients, this is the first time they start to feel what normal is. They may have thought they felt normal until they start to actually heal the root cause of what's causing whatever ailments they're going through.
Yeah, and we really have seen that with GLP-1s. Even myself, I didn't get introduced to GLP-1s until I went through menopause, but I now am like taking my life experiences, and I've never not had food noise. Even though I was always super fit, I couldn't eat more than 1,600 calories. I couldn't even eat an apple without getting fat. And then I got introduced to GLP-1s, and I was like, now at 50 years old, or now I'm 51, was the first time I felt normal. And so it's so funny that you say that, because I hear that from your patients as well, that they say, this is the first time I felt normal.
Yeah, same for me as well. I am a hedonic eater through and through. If I open up anything, I'm finishing it. I don't care if it's a whole loaf of bread, like it'll be gone, right? Luckily, I stay fit, but to get rid of that food noise is, man, it's life-changing, really.
I say it every day. It saved finding GLP-1s literally saved my life. And people will look at me and be like, you didn't need that. You're so fit. I'm like, but I should be able to eat a pizza and not gain weight, one pizza a year, or I should be able to eat an apple every day and not gain weight. And so it was like so liberating to find GLP-1s.
But I think one of the coolest parts about this is, sure, it's really expanded the footprint of compounding so that it's opening patients' eyes to it that may not have known it existed. But it's going to open up their eyes to everything else we have to offer as well, from bioidentical hormones, amazing stuff like low dose naltrexone, which I'm a firm believer that everyone should be on. And there's just so much more we have to offer that they're unable to get from the typical traditional medical care.
And that brings me to thyroid, because we have so many clients. I have had so many weight loss clients in my lifetime that have been given thyroid medication, and it's at those set parameters. And we never ever can find the sweet spot. And they're so afraid to go to a compounding pharmacy. But the compounding pharmacy can help you find your sweet spot in your thyroid medication. So it isn't just GLP-1s. I think
Oh, yeah.
thyroid, being able to find the sweet spot for thyroid medication is huge, because too much, they don't get any sleep. Too little, they still feel so crummy. And the manufacturers make it at set intervals where you guys can really help them fine tune it with their doctors.
Yeah, exactly. And that, that goes back to the point where I said one of our main purposes is to fill in the gap for drug shortages, but the other purpose is to be able to provide customized personal medicine that's tailored just to the individual, to find that sweet spot that they're unable to find on the two commercial strengths that they're sitting in between. You got 5 milligram, 10 milligram. Well, they need to be at 7.8. We can get them there.
And you can out microdose too, which is, I know we're all talking about microdosing these days,
Yeah.
but if you're looking at GLP-1s, they come in set pens if you're getting it from the manufacturers. Then now with being able to compound, we now can microdose GLP-1s. Now, I didn't do well on microdosing of GLP-1s. It didn't control my hunger and my food noise. I opted to taking 5 milligrams of tirzepatide every 33 days is how long I can pretty much go on that 5 milligrams and not drop too much weight and everything like that. But I have clients that are doing amazingly well on the super low dose microdosing of GLP-1s, and they couldn't do that if it weren't for you guys.
Yeah, the pens, you have 2.5 milligram increments and that's it. You can't do any more, any less. And that's very unfortunate, because with these vials, we offer what we're considering flexible dosing that patients can be tailored on, whether it be microdosing or whether they're even needing to go up by different increments than 2.5. Well, they can achieve this. And so if the patient's needing that, if they've tried the pens and that 2.5 milligrams too big of a jump, they're getting too many side effects, they
I
don't
was
want
just
to
going to say that side
it.
effects.
Yeah, I mean, that's side effects come with higher doses. That's kind of as simple as it gets. And so to be able to offer in between doses with these vials that we make is, I think, an extremely important part in the healthcare space for GLP-1s. And patients need to talk to their doctors and make sure, or providers in general, and make sure that they're giving them this feedback. Hey, that jump's too big for me. And then their provider can decide, hey, well, let's send you to a compounding pharmacy. I'll write a custom dosing schedule for you. And then they can bring that over to us and we'll get them exactly what they need.
Yeah, and that's really what I love about, especially for GLP-1s. We know low and slow is the best way to achieve sustainable weight loss with GLP-1s, but also allows us to either titrate you off of your GLP-1s or get you to a maintenance schedule of GLP-1s. So we don't have to constantly be hitting your body with these really high doses of GLP-1s to maintain your success.
We have I would say, like, of our patient population on GLP-1s, a majority of them aren't even getting to the high doses. We're
I
able
agree.
to achieve what they need, kind of like that middle line dose in between with those in between doses. It's working for them.
Yeah, it's really awesome. So, Matt, if you had any advice for all of these GLP-1 clients out there that are a little nervous about compounding pharmacies, what would be that word of advice or a paragraph of advice that you would give them?
Yeah, I would encourage them to reach out to a compounding pharmacy, ask to somebody in management or something like that. And the one thing, if they have the time for it, ask for a tour, because they're going to see these top of the line, state of the art labs that the medications are being made in. And I think it's going to really open their eyes, like, wow, this is actually not what I envisioned. It's not somebody in their garage, right? Or just somebody making something on the counter. These are in legitimate state of the art labs. And so that'd be the first part of advice I'd recommend. If they don't have the opportunity to do that or can find the time in their day, then start to ask for the document trail. Kind of like, think of it like a Domino's pizza where you can track your pizza from start to finish. Well, that patient should be able to ask, can I see where, if I were to order a med, can I see start to finish, starting from the powder all the way to the finished good, what that'll look like and how you can prove to me that it's safe and effective.
That is amazing advice to ask for that. Matt, thank you so much for taking the time to talk to me about this new era of weight management and GLP-1 weight loss medications. I really appreciate you taking the time.
Of course, I'm here to educate and be as resourceful as I can for anyone.
And that was Matt from Strive Pharmacy. I knew you guys would get some good information out of him. I'm Sharon Polsky. This is the Weightcare Podcast. Thanks for tuning in. If you enjoyed today's episode, don't forget to subscribe and leave us a review. It really helps us reach more listeners just like you. If you are ready to start your GLP-1 weight loss journey, you can go to www.joinweightcare.com. We'll be back next week with another exciting episode. So until then, keep exploring, keep learning, and keep growing. Thanks for listening. I'm Sharon Polsky, your GLP-1 Fact Fairy. Ciao for now.